I think that's super important, Neil. I mean, for me, it goes back to the relationships again. I keep a tight community of the specialists that I do refer to, and a lot of it has to do with just understanding each other's treatment patterns, right? You can also have a more comfortable dialogue, and you're also speaking to one provider about 10 patients as opposed to 10 different providers for 10 different patients, So if you're able to foster strong relationships with other specialists, I send to the same compounding pharmacist for almost everything. It streamlines communication, right? Because you're not getting pulled in so many different directions when it comes to communication. That will go a very long way. And then I think for the second part of this question, how can pharmacists and other healthcare providers help? I mean, I think this webinar alone is excellent. I like listening to your different perspective on a lot of these topics. I'm learning a lot, even just being on this as well too. And I think there needs to be a lot more collaboration like this in educational settings, right? Where there is, more of a pharmacist approach in certain schooling as well as in real world practice too, so that we understand, in the hospital setting, you see that, on rounds and things like that. But what about the office setting? Where are we getting that dialogue, and this webinar is a great example of it. So thank you for putting this together, because I think it's very beneficial.